Good morning. This is Assemblywoman Petrie-Norris. Thank you so much for joining us for today's Facebook Town Hall. Today, we are focused on the inside stories in the fight to protect COVID-19 patients across Orange County. Today, we are going to be talking with some of our frontline healthcare workers about the COVID-19 pandemic in Orange County, the situation right now in our Orange County hospitals, the latest advances in our ability to treat this disease, what we can expect, and importantly, the role that all of us can play in fighting this pandemic. I am so pleased to be joined by three terrific panelists today. Seth Tygan is the Chief Executive of Mission Hospital. Dr. Jason Hurd is the president of the Orange County Medical Association, and Rick Martin is the chief nursing officer at Hurd Hospital. Thank you all so much for being here, and more importantly, thank you for the work that you're doing each and every day on the front lines in the fight against COVID-19. Before we get started, if we can just take a few minutes, if you can introduce yourselves to the folks at home. Dr. Hurd, we'll start with you.
Thank you, Assemblywoman. I'm Jason Hurd. I'm the current president of the Orange County Medical Association. I'm also the chief of radiology for Anaheim and Irvine Kaiser Permanente campuses. And I've been for a while on the government relations team with KP as well. So the Assemblywoman is familiar with me. Nice to see you again. Thank you for the invite.
Good to see you again. And Mr. Tygan.
Assemblywoman, thank you for having me today. Seth Tygan, Chief Executive at Mission Hospital in Mission Viejo and Laguna Beach. I've been here working with Providence St. Joseph Healthcare for the last year. I just celebrated my year anniversary. I've shared a lot with folks. If you had to pick a team building exercise, pandemic wouldn't have been on the top of the list of things I would have picked, but feel really lucky to be here working with this team. And of course, with all of our kind of brother and sister health systems here in Orange County, we really do have an amazing community. And I think our conversation today will be about how we're all working together to make it better. So thanks for having me.
Well, thank you so much for being here. And Mr. Rick Martin, thank you for joining us as well.
Thank you for inviting me. I've been with Hurd 29 years. I'm the Senior Vice President and the Chief Nursing Officer. And also it's our privilege to be able to work with our colleague hospitals in the county to provide the amazing service they need during this unprecedented pandemic.
Well, thank you. And as Mr. Martin said, this really is an unprecedented crisis, and I think it has been top of mind, top of newsfeed, and on the front page of every paper for the past 6 months. But for many of us, it still feels like it's statistics. It's it doesn't always have a human face. The three of you are on the front lines. Your team are on the front lines of fighting COVID-19 every single day. Can you give us just that inside perspective of what's happening right now in your hospital? Mr. Tygan, we'll start with you.
Sure. I think from our caregivers' perspective, one of the things that's very encouraging is we've gotten good at this work. I think hopefully my colleagues, healthcare colleagues, will join me in saying when this all first started, I mean, as we were learning more about the disease and how to protect our caregivers and our patients in order to take care of the community in the most meaningful way, there was lots of learnings there early on. I think now, as we're kind of 5 months into this, it's kind of become what I'll call our standard work. So we're very good at it, and we've been able, I think, the benefit of being in a big health system, procure a lot of those things that maybe there's been a national shortage on, whether it be PPE or pharmaceuticals or whatever it might be. So I think the evolution of the work has been pretty remarkable to watch. And then I think, first and foremost, we've really tried to put caregiver safety and patient safety out front and center in all the decisions that we make. So it's been an evolution over the first 5 months, but I tell you, we're a lot better at this work than we were maybe in the spring of the year.
And I think that's very encouraging for all the folks at home to hear. Mr. Martin, what is it like right now on the ground in Hurd Hospital?
So since this started in January, we've seen over 1,000 COVID patients, and about 500 of those have been admitted. The others have been treated and released. As our colleague just said, we're getting much better at how to treat these patients because we're learning nationally what's the best way to approach the care of the patients with new medications, new treatments like plasma, which is truly making a difference. The challenge is continue to educate the community of the importance of wearing a mask and social distancing and hand hygiene and all of those elements. We're getting more and more support from individuals in the community that really understand this and want us to be able to have the resources that we need, both at the federal level, the state level, and the county level, so we can provide the best possible care, particularly as we go into the fall season with flu and having both of those things joined together with having flu and also having COVID to deal with. So we need to have the support of everyone.
Absolutely. I think as Governor Newsom often says, this is, it's a solution that is going to require 40 million Californians working together and
Yes.
pushing in the same direction in order for us to meet this crisis. And Dr. Cord, what's it like on the ground right now at Kaiser?
I think I echo a lot of Mr. Tygan's comments. I think when this first started, there was a lot of disarray, and it was difficult to determine exactly what even the appropriate things to do necessarily were first. Information was coming out at a rapid pace, and we were constantly adapting. I'm fortunate to be in an integrated care delivery system, and so to some degree that helps with information dissemination and management. But certainly even simple things that we used to do at the beginning, logistically moving patients around and things like that, things of that nature, are a challenge when you're not completely sure exactly how this goes. I certainly echo both my colleagues' comments that this has been an evolution. We feel much better prepared to manage the scenario now than we did at the onset. And I also want to give a shout out, if you don't mind, to Dr. Sal Hernandez, who's our Chief of Infection Control, who, as you've noticed, I'm a radiologist, and so he and I spoke immeasurably about these processes and planning for this discussion. And so I wanted to give a shout out to our ID guys and our pulmonologists, because they certainly have earned their chops on this event. I think this has brought us together. It's united us. It's bonded us, and we certainly feel better prepared than we used to. We were one of the first to do the drive-throughs, and now we see this relatively extensively. It certainly has changed the dynamic of the way medicine is delivered. And if you don't mind, I want to put in a plug for the community. As the Orange County Medical Association president, one of the things that I had the honor of being involved in was personal protective equipment giveaways that happened in the community. We gave away over $4 million of personal protective equipment to various small and medium-sized practices, those under 50 people. As Mr. Tygan noted, obviously the larger facilities have the ability to procure things that might be on a national shortage, and the CMA and the OCMA wanted to make sure that that was, some of those resources were available as well to the smaller practices that are struggling to some degree to make ends meet with diminishing reimbursement while simultaneously caring for patients and having to protect their own staff members. So that was a wonderful opportunity. Overall, I think we're getting better every day at managing this. It's the new now, and we're just going to continue to get better at it. But we certainly have flattened the curve slightly, and I appreciate the efforts that have gone into accomplishing that.
Yeah, when we are learning what's, I think, been really phenomenal to see over the last 6 months is the reality is we're learning new information each and every day, and there is so much to take in, not just kind of locally, but all around the world, where we've got new insights and are developing new best practices kind of in real time, which it's phenomenal. I think in many ways it can seem very overwhelming, but it is phenomenal to see. I think the ingenuity with which so many of our scientists and our medical professionals have approached this challenge, and also kind of picking up, Dr. Cord, on what you said, the way that our community, businesses large and small, individuals, of every variety, have really rallied together to meet this moment, to do their part to help our community get through this. And that, to me, is, that's what gets me out of bed in the morning, and makes me believe that we will get through this. So was there a case, and Mr. Martin, I'll start with you. Was there a specific case at your hospital that really kind of put the pandemic into perspective? A particular COVID-19 patient that you or your colleagues treated?
Yes, it was the end of January, and we received the first COVID patient seen in California. The county health department asked us to see the patient. He had been traveling from Wuhan, China, We didn't know a lot about the virus at that time. We'd been hearing about it. And then we were asked to take this patient, which we did. We have a great infectious disease doctor, Dr. Phil Robinson, who cared for him. And this gentleman was able to receive treatment and recover and do well. And then once he got through the treatment plan, the county health department asked us to keep him for another few days because they need to make preparations for him to go home and be with his family. So we kept him a few extra days as they made those plans and preparations. In addition to that, we've seen at least 10, maybe 12 patients that we've transferred in from Southern California of hospitals in that area that were overwhelmed with patients. And we took those transfers so we could help them and provide additional care for very complex COVID patients.
And that too, that's something we've seen all across the state has been the areas where hospitals have been overwhelmed. We've been able to, to assist other counties with additional surge capacity, which has been an incredible partnership. Dr. Cord, a particular story or a particular patient that really drives this home for you?
Yeah, I think I'm going to use the name because he actually has given permission. It's Corey Hurd, and he was our first patient that was formally admitted all the way through the ICU. He spent 46 days under our care, 32 of which he was in the ICU unit. And this was at the beginning of the pandemic when it was much more challenging as to what are we going to do, what are the needs, what's the best treatment, how should this be managed. And the day he was, for me, the moment it was the day he left, and that was after his 46 days. He was just about to get a tracheostomy put in because he'd been on a ventilator for so long. And by the grace of God, he managed to start breathing on his own and had recovered enough that he didn't require that. And soon he was off ventilation. And the 43-year-old, he was a 43-year-old man. We got to experience the excitement of his wife, but one of the things that was a lasting moment for me was that all the staff, all the ICU nurses that had cared for him, all the physicians, the pulmonologists, we all lined up in the hall. And as he left, he held a sign that said, "Keep calm, I'm finally going home." And he was received with cheers from all the people that had taken care of him throughout the course of it, and some that hadn't, who just wanted to join in the celebration of life that he was engaged in at that moment. So he got to be wheeled out of the building, to cheers from people that had been involved in his care, and that was very heartwarming, and it was certainly a sense of accomplishment for all those that had committed this amount of time. So
right, and so much, yeah. I mean, just the relief and the joy for his, as you said, his wife, and his family, yeah, and the entire community. It's incredible. Yeah. And Mr. Tygan.
I think similar to Dr. Cord, one of the most remarkable things through all of this has been send-off ceremonies, or we call them clap-outs or clap-offs, of watching a patient that's maybe been in our ICU. One of the first ones we did here, for almost a couple months, on a ventilator, get a chance to go to that next level of care. In this particular situation, we had a patient leave and then go to our sister campus in Laguna Beach, where we had relocated our acute rehab unit. And I happened to go to both hospitals, and I happened to be there on the day he was being discharged from Laguna Beach. And so I got to be part of 2 clap-outs for this individual. But the best part, as you heard Dr. Cord say, is seeing our caregivers and our physicians and the people that were caring for this individual for months get to see the joy on their face of this person going home. And then the cherry on top for this particular instance was, the son, the adult son, daughter, and wife waiting there outside the hospital, having not been able to have physical contact with the spouse and the father for a couple months, and to see that embrace was really amazing. And so again, I think when we think about healthcare and how lucky we are to do this work, those are the moments like that will be burned in my mind forever. Just thinking about it as a parent and as a spouse and as a community member, how hard this has been for people to kind of navigate from a healthcare standpoint. But the great stories are really rewarding when we get to be part of them and get to see people go back home.
Absolutely. And I do think it is also important for people at home to realize and to remember that we do have so many of these incredible stories to celebrate, but we also across our county have lost 810 individuals from COVID-19. And these are, 810 families who have had a loved one ripped from them. So I did have a couple of questions from folks. I think people would like to understand more like the experience for a COVID patient. And Mr. Tygan, you started to talk about this a bit, but are patients able to see their families right now? So if you're a COVID patient in the hospital, are you able to see your family members?
Well, the answer would be no, because we're not allowing visitors, but there's a variety of different circumstances that we do allow visitors for, and unfortunately one of those is end of life. So we do allow families to come together or individuals to come in and see a patient if in fact they're not going to make it out of the hospital, which thankfully has been a rarity. But to your point, if you look across all of Orange County, that's a pretty staggering number, just as we think about more than 800 patients. So there are those situations. I think we've tried really hard to use technology, just like we're doing this platform today, where we use FaceTime or iPads or Zoom to allow for patients that maybe aren't intubated to be able to communicate with their loved ones. We've had really great stories. Just ran on one of our social media channels. This isn't a social media plug for us, but I just thought it was a great story about a woman that was an inpatient at her Laguna Beach hospital, and her husband came and played music outside the window. And that was their ability to interact with each other. And so I think just as a society and as people, as human beings, we're getting really creative in thinking about how we can interact with our loved one when they're in the hospital, because it's really challenging, not just for the patient who desperately wants to maybe have somebody here with them, but for the family member that feels like, gosh, I really wish I was there at the bedside to be able to talk to the physician or the nurse and know what the plan is. We've had to get a lot better at finding different creative ways to communicate with folks out in the community. And it's actually, I think it's going to benefit healthcare. It's going to make us better because we're using these technologies in a different way moving forward.
And I think, yes, and we've seen that in a couple of places where we've, kind of been forced to take some steps on the telehealth side, which actually I think are going to turn out to be, pieces of progress that are good and that last beyond this pandemic. So, Mr. Martin, for your Hoag Hospital patients, how long is a COVID patient typically in the hospital? When someone comes in, and I think you said half the folks you've seen did need to be hospitalized, what's the average length of stay?
So currently our average length of stay is down to 6 days, and that's due to treatments that are provided here that Dr. Robinson, our medical director for infectious diseases, implemented. So we're using remdesivir. We've been on studies with that, also the plasma and some of the neuro items, but that really has made a tremendous difference in the survivability and recovery of these patients and getting on top of that early. And we started remdesivir very early in the cycle of COVID as soon as we learned that that was going to be a good opportunity for those individuals.
And so you mentioned, I think we've all talked about the fact that each and every day we are learning new information about this disease. So Dr. Cord, can you just, give us the non-doctor's version, the layman's version of, what the current science right now is saying about treating COVID-19 and some of the recent medical advances that have really been game changers?
Yeah, well, I think I share, Mr. Martin's commentary. I think we early on started the remdesivir components, and we've seen that combinations of steroids and things of that nature have certainly shortened our stays as well. We're somewhere in the 6 to 8 range as well, and unfortunately, ICU stays clearly longer, 3 to 4 weeks in general. I think plasma and things like that are going to be certainly utilized more and more. I think our familiarity with the disease process and the taking a little later approach to ventilation and going with high flow oxygen and things like that on an earlier basis in order to keep people breathing on their own has been critical. I just want to emphasize that an ICU stay for a patient is it's a challenging stay. This is not a disease you want, and this is something that if you can avoid it, you want to avoid. These patients, require being mobilized from, prone to recumbent multiple times a day in order to keep the fluid shifts going, and that's with a person that's potentially intubated. That means having a breathing tube in place. These are challenging maneuvers. They're very taxing for your ICU staff, and it requires a lot of nursing care to get through. So if you can avoid, acquisition of the virus, that's of course the best choice. And of course, improving our treatments is always our goal, and it seems that we're doing better in that direction in general. But certainly, we want to do our best to keep as few people in the ICU as we possibly can, because they stay there longer and it's a much more challenging recovery. So I think there's more and more to come. And of course, we're all looking forward to a vaccine and hoping, and we're involved in some of the trials with that as well right now, and administering them. But if I had to put in a plug, and I think we hinted at this earlier, I would put in a plug that the flu season is coming up right now. And, for all those folks out there who hesitate to get their flu vaccines or don't think that it's important, the worst case scenario I can think of right now is having a combination COVID and a really aggressive influenza season at the same time to deal with, both from testing, complexity, comorbidities, you name it. It's a bad idea. And so I think we should almost consider, and I hesitate to say this, we should almost consider a flu vaccination to be sort of part of our regimen and taking care of this, because we don't want to see both of these things hitting at the same time.
Okay, so everybody, it's hard to believe when it's 100 degrees outside, but flu season's around the corner, so everyone needs to get a vaccine. And just in terms of the experience of being a COVID patient, you talked about the ventilation that is required when someone is in ICU, and the fact that has major long-term consequences. Mr. Tygan, we're also seeing, and again, learning every single day, that this disease has long-term negative and sometimes incredibly dire consequences, even for the individuals that do survive. Can you just speak to that a little bit?
Well, I'll give you a non-physician opinion, and I hear these conversations, of course, happening with our medical staff and for other people on our team, and it's, I think, kind of unclear at this point what the long-term effects are, just because the virus is so new, and those people that are back out in our community that have maybe been able to deal with it, whether it be through a hospitalization or staying at home in quarantine, or getting medications on an outpatient basis, they're still in kind of the infancy of their journey and figuring out what that is going to look like long term. I mean, I think we're going to know a lot more as we get into the fall and even this next year, what some of those longer term effects are. I would just tell you, conversely, it's interesting. One of the things that we talk about often is the impact that it's having on our caregivers and the people at the bedside. It really is really emotionally stressful, physically draining, as you're hearing Dr. Cord say, these patients that require one-to-one ICU care. I'm married to an ICU nurse. I'm a clinical person by background. And their number one fear is, taking this home with them. And so making sure that they have the proper protection when they're here working in the building. But it is very physically taxing, and then just emotionally, again, watching these patients be in the ICU long-term without maybe the access to their family and dealing with all of those things. It's really been a challenge for our nurses, our doctors, and really all of our caregivers dealing with this patient population.
Yeah, and I think, and folks all across the community, I think we feel just such incredible, profound gratitude for you and for your teams. I know in my neighborhood, there are lawn signs everywhere thanking our healthcare workers, our frontline workers. I'll start, Mr. Martin, with you with this question, but, have you felt the support of the community during this really tough time?
We have been really blessed with support from the community. Early on, members of the community reaching out to us, what could they do to help us, whether it's to deliver food to the staff or to make masks for the staff or even for patients. All those offers came through, people offering to donate money, and they did donate money. And they continue to make those offers to support everyone because, as was said, they know how complex this is, how draining it is for the nurses to care for these very ill patients and to give their heart and soul for that care. In addition, knowing that it isn't just the stress and challenges they're facing at work, but also in their personal lives. They have the same elements in their personal lives, the uncertainties that we all do when we leave the building on how to deal with certain issues, how to overcome that, and then also come back and face the needs here at work for all the patients. One of the things we did early on was, because there were so many shortages of food and paper products and et cetera, we opened up a little grocery store inside the hospital so the staff could buy food, they could buy the paper products, because they really didn't have the time after they left work or the energy to go out and do shopping. And many times they couldn't find what they needed. So we've pulled out all the stops to look at ways to support our staff internally, and the community has done a tremendous job supporting the hospital and the staff.
Good. I'm glad to hear that. I'm glad to hear that. Yeah, the gratitude I know the community feels is coming through. Dr. Corder or Mr. Tygan, anything you would add on that subject?
You know, I would add that the community has been amazing. People have certainly tried their best to provide any supports necessary. I would add on to Mr. Tygan's commentary that this certainly extracts a huge toll on the healthcare providers, especially our frontline nursing ICU staff. And so I am particularly sympathetic to them and our pulmonologists and our infectious disease physicians. You know, I hate to say something like this, but you know, nowadays doctors are not as used to losing patients. You know, we're used to having really good therapies, and you know, we are in many ways, our nursing staff and our physician staff are the second victims, if you will, whenever there is a loss, because you know, there's been a huge investment of time and commitment, and we want to see these patients make it through. So when we lose one, it's particularly bothersome, and it's something that we're not as used to seeing on a regular basis. And I think that just the sheer number has, like you mentioned, 810 is a lot of deaths for Orange County. That's not a small number, and all of our hospitals have shared in that. And I'm sure that there's you know, a lot of physicians and a lot of ICU nurses and frontline professionals who will feel those impacts and that burnout at a later date. Right now, you know, in medicine, we're taught to endure acute events and to act in a selfless manner and run forward into the storm, right? And so, you know, when that adrenaline's pumping, you can do a lot, and you can maintain your care for a long time and let the world kind of go by. But there hits a point where all that catches back up, and so I do have a fear of what I'll call the third wave, and the third wave is that, you know, the healthcare providers slowly burning out over time. The good news is that I think support like this and the outreach of the community is very protective against that. And I think I'm very fortunate to be in a position with the Orange County Medical Association where I get to see the good in all of us, and I get to see you know, all of our hospitals working together and rowing in the same direction. And for that, I'm immensely proud. And thank you very much, by the way, for having us today on this and for bringing a spotlight to it. But you know, I really personally appreciate it, and I know that the staff and physicians here at Kaiser Permanente, as well as the Orange County Medical Association members, appreciate you highlighting this. So thank you.
Well, thank you. Like I said, you know, my team and I and all of our constituents, we appreciate you tremendously. I actually want to switch tacks slightly, because I think that, you know, one result of just the fact that we're learning new information every single day, that there's so much evolution in this disease, I think has been that it creates an opportunity for a lot of misinformation. And there's a lot of myths that are still circulating around this disease. And, you know, I think nature abhors a vacuum. And so when there's uncertainty, you get all kinds of different theories trying to fill it. So I want to spend just a little bit of time, you know, talking about some of the you know, sort of myths, misunderstandings, and clearing those up for the folks at home. And I believe, Dr. Cord, you have a video that you were going to share with us. The California Medical Association released a public service announcement, I think a couple of weeks ago, that it was very impactful. And I know we wanted to share that with the folks at home.
There's a virus in the world today. It's been infecting our communities for years, making us less safe.
You literally cannot mandate somebody to wear a mask.
Now it's growing, feeding on fear and division.
Activists showered state senators in what appeared to be human blood.
It's extremism that attacks science, vaccines, and protective masks that keep us safe. It's not harmless. It's dangerous. It's deadly. We can stop COVID-19, but we shouldn't have to fight two viruses at once. Enough is enough. No more harming our children. No more harming our parents. No more intimidating doctors, nurses, and public health officials. No more.
I protest face coverings.
The cure for violent extremism is to call it what it is. Deadly.
Yes, tell us what inspired the California Medical Association to put this video out.
So obviously the video speaks to the necessity of the masks and some of the turmoil and circumstances that have surrounded the concept of the politicization, if you will, of mask wearing. I always like to tell people that masks aren't a Republican or a Democrat thing, and we're an independent thing for that matter. They're just protection. When we are in our hospital settings, our doctors, our nurses, our medical staff, we respect the virus. We have seen it. We have seen its devastation, and we have heard the sound of ventilators in the morning walking through the halls, and it's not a good sound. We don't want to see more people infected, and we don't want to see more people harmed. We wanted to, the CMA, the OCMA, and the medical community at large wanted to send a very strong message that masks are critical to this, and they're not a restriction of our civil rights or anything else. They're just good medicine and good science, and something that we all should be engaging in. And then we also wanted to highlight that those people that are engaged in these activities, our public health officers who are trying to set rules and things of that nature and trying to provide guidance out of the mayhem, should not become targets for trying to influence the public good, and that we stand with our public health officers and those in the community that want to ensure the public welfare, regardless of political affiliation or personal whatever beliefs. This is a medical issue, and the medical issue says wash your hands and wear a mask. And if you don't want to get other people infected, that's what we all should be doing. I think sometimes we tend to let our guard down a little bit in smaller groups and family and friends and things of that nature, and that can be particularly challenging times to wear a mask. And we want people to know that it's still appropriate, it's still the right thing to do no matter when. So I think that was really the inspiration for the video. But
Yeah.
I would particularly say, you'll notice it on that CMA video, there's a few cuts that will be familiar faces from Orange County, and we were a bit of a hot center for some of that political activity, unfortunately. And I'm personal friends with Nicole Quick, and I was super sorry to see what happened to our public health officers with regard to that. So it hit home a lot. I'm very happy for Dr. Chow. He's a great guy, and he is certainly taken us in the right directions as well. But it's unfortunate to see our public health officers targeted.
It is, and we're living through an unprecedented crisis and just devastating loss across the country. Hundreds of thousands of lives will be lost through this. Hundreds of thousands of families ripped apart. Our economy is in free fall, and we have this kind of twin tragedy happening, which is the politicization of it, which has made it that much harder for us to confront this effectively. And lives have been lost and are being lost as a result. Mr. Tygan, are there any other myths? Would you like to build on that, or are there other myths that you would like to address and clear up for
I agree with Dr. Cord. I mean, the way that we've been trying to educate our community, whether it be through the Chambers of Commerce or through other civic platforms where we can reach out and speak to the community about what's going on in the hospital, the overarching message is, while the hospital and healthcare systems are here to deal with the medical disease or the virus, it's really a community health issue. I mean, we owe it to one another to take care of each other and to wear our masks out in public and to wash our hands. And it's just as challenging for all of us that work in healthcare, for everyone that doesn't. We don't get excited about wearing our mask in the grocery store either. But it's really a way for us to signal to folks that we care about one another as people, and that we're trying to slow the spread of the disease. So I would just echo Dr. Cord's comments. We're just trying to be steadfast in educating all of our stakeholders on that very topic. It's really our cross to bear, and it's our time to do this together to flatten the curve.
And Mr. Martin, do you feel like we are starting to get through to people? Do you feel like there has been more of recognition that wearing masks and is a common sense health precaution? Or what's your sense right now?
It's depending on the communities that you go to. So I was in Los Angeles over the weekend, and almost everyone I saw on the street had on a mask. But when I go into parts of Orange County, very few people have on masks. So again, it depends on that community. And as was said earlier, it's just really important that people understand the benefit of wearing that mask, not just to protect yourself, to protect others. It's just like wearing a seatbelt when you're in the car or putting in a child seat for your child. It's just as important as that. You want to protect that loved one with the seatbelt or the child seat. You want to do the same thing about wearing a mask. It's very simple. It's very basic. I happen to be in a room with just one other person here, but I need to protect that individual and protect myself. That's why I'm wearing a mask. That's why we're socially distancing in this room. So that's the key element. So when you talk about the community, what support they're providing us. So if they truly want to provide support for the frontline caregivers, the nurses, the physicians, and the other hospital employees, wear a mask so that you don't have a need to come to the emergency room or to be admitted or receive treatment and overwhelm the hospitals like happened in the early days of COVID. And as mentioned, as we head into flu season, it's even more important to wear a mask to protect yourself from COVID, but to also protect you from flu. So we can truly identify which patients have flu, which patients have COVID, and we have the hospital resources to provide that care and not be overwhelmed. It's a simple thing to help all of us.
Right. It is a simple thing. It is a simple thing. And I think, as with most things in the world, it's like common sense and common decency go a very, very long way, and will go a very long way in our ability to effectively confront and overcome this pandemic. So we've mentioned that flu season is coming. But one of the kind of, common objections that I've heard from folks that are maybe COVID skeptics is like, hey, this is just the flu. Why are we making such a big deal? Can you, Dr. Cord, help us understand, why this isn't just your normal everyday flu season?
Oh, well, yeah, you can almost tell from the video, I immediately get a guttural response the second somebody says it's just like every other flu. I have to pause and try not to just get angry when I hear it. We've had, I think it's almost easier to put as a story. We have had 5 couples that, as a result of small family reunions and things of that nature, have had deaths. Okay, and we've had husband and wife pairs that have died. We've had a daughter and a mother that have both died, and probably, although all are tragic, we've also had a grandson and a grandfather pair die as an end result of a small family gatherings and reunions and things like that. People less than 20 with social, friends that they know that have brought it home to their house. I live in a 3-generation household with my over 80-year-old parents, my wife and my college age students. And, if their friends come over, they have to wear the mask. That's just the way it goes. It's not a regular flu. Regular flu doesn't have this kind of penetration and death rate in general. We don't typically see, regular flus have this kind of a devastation. We know what the flu cycle looks like, and we've had this discussion before where you can see the curves and you can actually see the percentage unexpected deaths. That percentage unexpected deaths represent people that COVID is attacking. Flu is part of our normal cycle. When we consider what a normal death rate is, flu is part of it because we know it's a cyclic event. Flu has a vaccine. And it's pretty darn effective. And if you add a mask and social distancing to it, flu season this year could be really small if we actually took COVID seriously, because a lot of the same protections we apply to flu certainly do apply to COVID, but that doesn't make them equivalent disease processes. It doesn't make the infectivity the same. It doesn't make the devastation the same. And we don't even know completely what the long-term consequences of this is, not only for our elderly and vulnerable populations, but even for our pediatric populations. We don't know what the long-term consequences are. So to pretend that this is the same as some other disease that we know and are familiar with is us just trying to feel comfortable with the process. It's not based on real knowledge. We know that the numbers and the deaths are far more aggressive and than flu, and we know that we don't have anything we can do except masking, social distancing, and good hand hygiene. Whereas with flu, we actually have vaccination. So there's no real comparison. Although it's great to apply the COVID the COVID precautions toward flu in hopes of also not having a huge flu season, which we would like to not have happen.
Well, and as we're looking now, as we were talking before we got started, we've got various age children who are starting back at school with distance learning. There's been a lot of conversation around the children and their risks to COVID-19. Mr. Martin, can you speak to that a little bit about? Can you speak a little bit about what we know about children and their vulnerabilities to COVID-19?
Well, and Dr. Cord should jump in as well. So they're still exploring and understanding how this is affecting children. They may have a light case of COVID, but they could carry it home to their family members, to their parents or their grandparents. And again, as he mentioned, we don't know the long-term effects in the pediatric population yet. We're just learning new things that are coming out and the impact to pediatric or to children.
Dr. Cord, anything? Dr. Cord or Mr. Tygan, anything you'd add?
I don't have anything to add. I mean, I think this is one of those discussion points that we end up in a rabbit hole on, but the reality is it's pretty simple. It's we don't know. We know that they get infected. We know that they can die from it. We know that they can infect other people and they can die from it. And we know that there's things we can do like social distancing and masking that lower it. So to me, it's a very binary decision. We apply similar things that we apply to the adults, to the kids, and it's a relatively clear-cut course. This pandemic is not age dependent. It spans all the age groups. And if we don't know the long-term consequences, what mother or father really wants to put their child in harm with an unknown consequence? You wouldn't do it with anything else. Why would we do it with this? So I think it's a sort of a common sense approach applies. Regardless of how sick they can get, they certainly have the capability of passing it on. And we've had, as I mentioned, we've had grandson, grandfather combinations, that are deceased as a result of this. So it's clear that it can affect both young and old.
Okay, so whatever your age, our top tips, wear a mask, practice distancing, and we're going to add get a flu shot to our top 3 tips for today. And again, we've talked about flu season, and there's been a lot of talk about the second wave, this impending second wave. And I think we all have seen the videos, we've all seen the horrific pictures from around the world, and even here in the States of patients dying in hospital corridors because there weren't enough hospital beds, there weren't enough doctors and nurses, there wasn't enough equipment, there weren't enough ventilators. Is Orange County prepared? Mr. Tygan, is Orange County prepared for this second wave?
I think we're very prepared. I think one of the things the pandemic has done is it's really brought all the health systems together in Orange County. And I think we're probably across the country and across the whole state of California, but our Hospital Association of Southern California has done a nice job of kind of quarterbacking and bringing us all together, talking about the number of beds that we have, the number of ventilators that we have. Are there other resources that we need to ask for nationally or from a state or county perspective? And so I think that coordination should hopefully give the community a lot of comfort that we are very prepared and have a sense of how we can quickly pivot to deal with that surge in activity. And we've had a couple of those surges, early on, and then kind of the post 4th of July into late July. And now I think for many of our caregivers and physicians, the holiday that's on their mind is, of course, Labor Day, and thinking about, again, our big groups of people going to be getting together and potentially putting themselves or their loved ones or other community members at risk. And so again, and I know it's redundant, but this idea that we need to wear a mask, wash our hands, socially distance is really the kind of overarching message that will hopefully get us through this next holiday and get us on with the remainder of the year.
And I think what I would add, because there has been an absolutely, Herculean effort across Orange County and all across the state to prepare, to ensure we have sufficient hospital capacity, to ensure we have sufficient personal protective equipment, ensure we have sufficient ventilators. And our hospitals have kept our emergency plans activated. And so for all of those reasons, as Mr. Tygan said, we are prepared. But that is different than saying everything's okay It's not, we're fine. Because even though we say that we're prepared, we're not bumping up against our surge. I think, and correct me if these numbers are wrong, but right now we've got 414 hospitalized patients in Orange County, 132 ICU patients. But that's only like, only 29% of our ICU beds are currently available. Is that correct? It might not be the exact same at your hospitals, but for the county as a whole, only 1/3 of our ICU beds are currently available. So things don't have to spike that much for us to start bumping up against that, which is why we need to continue to take the protective measures that we're taking so that we can keep it under control and keep it within our capacity constraints. Another, an area, and I mentioned this, an area that has been a major area of focus, for all of you in your hospitals has been personal protective equipment. In the early days of this pandemic, it was, sourcing personal protective equipment was like the wild, wild west. There was a global shortage. Supply chains were, completely not functioning. Mr. Martin, what is the situation with your personal protective equipment right now at home?
As you mentioned, it was very challenging in the beginning because a lot of suppliers were being pressed on from every state trying to get PPE orders and everything that was necessary, but we were able to manage to get everything that we needed. We're currently keeping a reserve in place. We've been able to help out a couple other organizations and even cities that they needed PPE. We were able to make those donations to them. So we're looking ahead and making sure that everything we need is available. We're not just thinking there's going to be a surge, we're planning for the next surge. So we have the medications we need for these patients that are very complex, the PPE that we also need. So we have all of that ready and available to take on the next surge that will come forth. And your comment about beds, all the hospitals, ours included, we have all these robust plans in place to add critical care beds when we need to be able to add those. So again, just emphasizing that the public also needs to do their part. Again, we're going to keep saying it, wear the mask, social distance, do the hand hygiene. That's how you can help us get ready for this. The other thing is we need at the federal level for the government to do more to get other organizations or companies into producing the PPE we need to supply the country. We can't just rely on China. We need our own companies producing the PPE that's needed because it's not enough to rely on one source. And the same thing for our medications. Many of our medications and generics are made in China. They really need to be here in the US or countries that we can rely on. So there's not just one source where we're receiving these crucial medications.
And those are both such excellent points. And I know even at the state level, we have begun to look into initiatives to encourage even in-state production of personal protective equipment and other supplies to incentivize companies not just to bring production back to America, but to bring production back here to California. So that's
right.
Something I'm excited to be working on in the months to come. Dr. Hurd, what is the situation on the ground at Kaiser, both in terms of capacity, personal protective equipment, anything to add?
I think I echo my colleagues on this. That I think we have done a lot of planning and we have a lot of contingency plans in place in order to be able to open as necessary and close as necessary and move units around and have robust plans in place that would manage surges. Those are robust plans that I would hope we never have to use. And I'm sure that my colleagues agree on that as well. I certainly support your efforts, Assemblywoman, in helping us to make sure that some of these manufacturing items, particularly PPE and drugs, come back to this area. This has been an eye-opening event, and so I'm so thrilled that point was made by Mr. Martin specifically. I couldn't agree with it more that that's critical, and I think that's where we tie together, where we can bring the medical community back with our government agencies and really make a long-term difference. This caught us by surprise, and there was a lot of planning involved. I think we're at the point now that planning has come to fruition, and we're ready should the need arise. None of us want to see that need arise, and we'd like to continue to maintain it at a reasonable level. And I just want to throw in one other thought. COVID, it doesn't seem like it, but COVID's not the only disease process out there right now. There's a lot of people have illnesses of other natures and that need care and need management. And, occupying ICU beds with COVID patients that could have been prevented also slows the care of all those other patients that need it for cancer surgeries, that need it for GI surgeries, that need routine screening for, I happen to be a mammographer, that want to get their imaging done or their routine maintenance done. And, this is a prohibitive during this time to some degree to manage some of those things and to have adequate beds to do those at the same time if we tried to open everything at once. ICU stays are 3 to 4 weeks. So when you go down that path, the recovery period is slow. So, my wife always says, have a plan so you don't need it. And I would like to hope that she's right on this, that we all are making wonderful plans, and hopefully we don't need it because the public, embraces these protective mechanisms and continues to help us flatten the curve. And so, my call out is, I have a great plan. My colleagues have a great plan. Please don't test us on it. Let's get things done the right way and avoid being here in the first place. But if you need us, we are here and we are ready.
Right.
Assemblywoman, I'd like to add one thing if I could.
Yes, please.
So there's a lot of people early on that were very hesitant about coming to the hospital because they weren't feeling it would be secure and safe. And today, I had a call from a friend to say, is it safe for me to go to the hospital and have this procedure? We really, all of us, want the public to know that we have robust processes in place. It is very safe for you to come to the hospital, safe for you to go to the emergency room, safe to go to the urgent cares, safe to go to your physician's office. So don't hold back on anything where you need medical care. It is perfectly safe for you to come to the hospital. Actually, it's safer here than it is for you in the public because we're going to protect you here. So it's really important that they understand that the doors are open and safe for them.
I'm really glad. I'm so glad you made that point. Yeah, we have to, ensure that that we are minimizing the follow-on consequences from COVID as much as anything else. So we talked up front. You all talked about the fact that you've been through quite an evolution over the course of the last 6 months. We've learned so much over the last 6 months. What's the one thing you wish you had known back in March? I'll start, Mr. Tygan, with you.
I think this has shined a great light. I don't think this is unique to Mission Hospital. I assume my colleagues will echo this. We do emergency preparedness and we do drills throughout the course of the year, and we're always talking about preparedness, but dealing with something like this, I think, has been a great learning for us to make us better and probably more prepared than ever. I agree with both Dr. Cord and Rick. We hope for the best and plan for the worst. And that's kind of the situation that we found ourselves in now, is we have all these learnings starting from the spring of the year. And I think maybe one of the things that we wish we maybe would have been more prepared on is just that rigor of preparedness around even surge planning. We really haven't spent a great deal of time maybe prior to this about how we can surge and add a bunch of ICU capacity. So now we have the recipe for that, and I think that's going to be really critical because the next time we have to deal with any sort of health crisis in our community, that hopefully won't be like this, but if we have to deal with another one of these, or if this is with us for years and years, that we're very prepared now. So I think that's maybe been the key learning from our perspective.
And Mr. Martin.
It's been almost a century since we've had a pandemic, the 1918 influenza that killed almost 50 million around the world. And we have forgotten about that. We did have a couple warnings from individuals who told us to be prepared for pandemics nationally. We didn't heed that or listen to it. I think we need to learn from this pandemic to be prepared for the next one, which could be a year away, or maybe it will be another 100 years. But we have a habit of having short-term memories. We get through a crisis and get over it, and we forget about that. We can't let that happen again at the county level, the state level, or at the federal level. We need to understand that these pandemics can occur at any given time, and how quickly with jet service that they move around the world.
Yep. Yes, indeed. In the midst of this truly unprecedented crisis, we have learned a tremendous amount about how to combat this disease and about the role that each and every one of us can play. And make no mistake, there is still a very long road ahead, and so much of this fight is still in front of us. I want to say a huge thank you to all of our healthcare workers who are on the front lines of that fight each and every day, and a huge thank you as well to each one of our panelists for joining us today. to offer your insight and your perspective, and also your advice and direction. As we've heard from our panelists today, in order for us to show our real gratitude for our healthcare workers, in order for us to support them in this fight, we can all do three things. Continue to practice distancing, mask up, and get a flu shot. 3 simple steps that we all can take that can make a powerful, powerful difference as we fight this pandemic together. Thank you all for joining us. Be well, stay safe, and stay strong.